Hello, one and all. This is Dr. Akanksha Thaokar, a practicing homeopath at Ashu Homeopathic Clinic. Welcome you all to the 8th anniversary of Global GHK. So, my today's topic of discussion is GHK in the case of psoriatic arthritis. Before proceeding towards the topic, I would like to show my gratitude to Dr. Samuel Henneman and Dr. Gerd Hammer, and also to my guide and master through the journey of GHK and homeopathy, Dr. Ashish Sheikh Sir. Let us begin with what does psoriatic arthritis means. It is a complex, chronic, multifactorial inflammatory disease that involves hyperproliferation of the keratinocytes in the epidermis. This condition combines the symptoms of psoriasis, a skin disorder, with arthritis, joint pains, and inflammation. It is said that the exact cause of psoriatic arthritis is unknown. It may be because of the combination of genetic and environmental factors. According to the conventional medicine, there is no cure for this disease and we can only manage the symptoms. But is it so? Let us today understand the exact cause of this disease through the insight of GNM. Starting with the skin, as we know that skin is the largest organ of our body. It serves multiple functions that are crucial to the health and survival of the living organism. Skin consists of three layers: epidermis, dermis, and hypodermis. And in psoriasis and psoriatic arthritis, the epidermal layer of the skin gets affected. The epidermis is predominantly responsible for the sensory perception such as temperature, pressure, and touch. The epidermis consists of keratinized squamous epithelium which originates from the ectoderm and is controlled by the cerebral cortex. So the epidermis, it originates from the ectoderm and it is controlled by the cerebral cortex. The skin of the right side of the body is controlled from the left side of the sensory cortex, and the skin of the left side of the body is controlled from the right cortical hemisphere. Hence, there is a crossover correlation from brain to the organ. So, in skin diseases, we apply the principle of laterality. Now, let us see what is the biological conflict which is present in the cases of skin disorders. In man, touch is the most developed sense. Skin disease of epidermis often reflects the conflict which is related to the touch. The biological conflict which is related to the skin disorder is separation conflict. Separation conflict is a conflict which is experienced as a loss of physical contact. Skin diseases happens when you want to be in the contact touch with the person, place or thing but you cannot, or you don't want to be in the contact with the person, place or thing but you have to. It may be also experienced as real separation experienced with difficulty, fear of being separated or being left alone, and lack of communication. So what happens in the conflict active phases, the epidermis ulcerates at the area associated with the separation. With the continuing conflict activity, the skin becomes dry, rough, the skin begins to crack, causing fissures that may bleed. If the intense conflict persists for a long period of time, the skin opens up at the ulcerated area. Let us see what happens in the healing phase. During the first part of the healing phase, the ulcerated area of the skin is replenished through the cell proliferation. The skin will then swell up and become red, inflamed, irritated, itchy, and sensitive to touch, leading to hypersensitivity. Further, the blisters appear. After the epileptoid crisis, the blisters dry up and the skin normalize, providing there is no conflict relapse. Now let us see what is the exact cause behind psoriasis. So psoriasis happens when there are two separation conflict in the same person, where the one separation conflict is in the conflict active phase and the another separation conflict is in the healing phase, which means the person first has a conflict of separation and then it gets resolved. Later, he has second conflict of separation with the second event, but it registered in the same cerebral and cutaneous area. Two separation conflicts overlap each other on the same area of skin. One in the healing, that is the red skin, and other is in the conflict activity, that is the scaling. In general, one can call this persistent conflict activity, and hence, in the cases of psoriasis, we see the eruption have redness along with the scaling. Both of these conflicts are present in the mind, brain, and in the body. One of the two conflict of separation can relate to the feeling separated from oneself or from one's identity. And also there is a conflict of obligatory contact. Now, interestingly, psoriatic arthritis happens due to two different conflicts. For understanding the second conflict, which leads to psoriatic arthritis, let us have an overview of bone. So bone originates from the new mesoderm and it is controlled by the cerebral medulla. The biological conflict which is associated with the bone is self-devaluation conflict or loss of self-worth, which may be experienced through humiliation, accusation, scolding, abuse, which can be physical, sexual, or verbal, failure at workplace, at school, in sports, a poor performance or feeling of shame and guilt. Loss of status, loss of workplace can also trigger self-devaluation conflict or loss of self-worth. So what happens in psoriatic arthritis? The patient suffers from the separation conflict affecting his skin as well as from the self-devaluation conflict which affects his bones. In GNM terms, when a disease is associated with joint pains and skin rash, it occurs due to the conquering healing phase of self-devaluation conflict and separation conflict, most likely linked to the same conflict situation. That is, the healing phase of self-devaluation conflict and the healing phase of separation conflict give rise to the symptoms of joint pain and skin rashes. So from this, we got to know that what is the exact cause of this disease. Now, let us understand with the case illustration how devaluation conflict along with separation conflict leads to psoriatic arthritis. So, a 39 years old patient who works in the pharma company came with a complaint of psoriatic arthritis, which was diagnosed in 2014. Currently, the patient was experiencing pain all over his joints. Sensation was throbbing and modalities was usually on waking on. The aggravation of the complaints was seen on waking on. The current patches were present on both sides of his feet, back, and chest. Now let us see the history of his presenting complaints. The patient started saying that his mother died when he was in ninth standard. Further, he was sent to hostel by his father, and complaints began increasing on both sides of his feet when he was in 12th standard. The patient then consulted multiple doctors, including Ayurvedic as well as homeopathic doctor, yet had no relief. Since the eruptions used to come and go, he again consulted a dermatologist and started applying ointments. Further, in 2014, he suddenly experienced severe joint pains and got diagnosed with psoriatic arthritis. So here what we understand, there is a clear-cut suppression of the skin disease which went into his bones. So these are his eruptions. You can see the eruptions, they have redness along with scaling. Now let us see what this patient has to say. So, with the help of GHK, it was very easy for us to inquire the exact cause of his disease. We directly asked the patient about the separation conflict in his life, and that was what he said to us. Moving further towards his history, what he said was, during childhood, I lived in a joint family. When I was in ninth standard, my mother died in an accident. That incident affected me a lot. I was the only child in the family and I was very close to my mother. I used to share everything with her. I even used to help her in cooking, as I used to like it. After my mother's death, I was sent to the hostel for my further education. Initially, I did not want to stay in the hostel, as I often missed my father and family. I used to have a constant thought of my children. So this was the first separation conflict which happened in his life, which was the death of his mother. As I was in a military hostel, I used to visit my home very little. I used to feel lonely. My friends also used to ignore me, and even my father never used to call me, which made me very emotional that time. I used to feel alone and I used to weep a lot. I wanted to go back home. The second separation conflict which happened in his life was missing home. Feet. So see, what we have seen is the eruptions begins from the feet, and eruption beginning from the feet means the wish to go towards the person, place, or away from the person or place. Now here we are getting the history of separation, but as we have also seen that patient is suffering from psoriatic arthritis which started in 2014. So now the psoriasis has gone into bones. So we have to stop the patient and directly ask him about the devaluation which happened in his life before 2014. As doctors, we know that it is because of separation, but everybody does not get separation after ointments. Why did he get it? After we investigated, the patient got married in 2012. It was an arranged marriage. As I always lived away from my family, I wanted to stay with them. After my marriage, before we got married, my wife and I decided to settle down in my town place. But after marriage, she denied. This affected me a lot. I got very upset, more than angry. It was disappointment. After marriage, I had lot of expectations from her and she used to ignore me even after marriage. My wife never supported me. She never used to understand that this person has done so much to her and the family. She never used to appreciate me. Due to this, I felt alone. I felt neglected. I took the wrong decision of marrying her. It's my fault. So the devaluation which happened in this patient life was neglection by the wife. The feeling that I took the wrong decision by marrying her. So nature wise, the patient used to help everybody. He will never say no to anybody. But I also accept from them that they should help me whenever I need. As I am very weak in making decision, I need assurance and support while taking any kind of decision. Sometimes I feel that even if I do so much, still I had to suffer. I must have not married her. I do so much, yet there is no appreciation from her. Whenever I am distressed, someone comforts me, I feel better. I feel that there is somebody who is with me who understands me. So from this history, the medicine which we prescribed to the patient was pulse. Now, we will see the amazing results in our patient which we got after the applying the knowledge of GHK and also after prescribing the medicine. So these are the eruptions of the patient after making him aware about his disease, making him understand the exact cause of disease, and after prescribing him the medicine. Now here you can see that his eruptions have completely gone. Now let us again see what does this patient has to say about his improvement. So from this we understand that GHK is the weapon that helps us pinpoint the exact cause hitting the bull's eye to achieve a cure in the patient. Thank you.